Confused about what career to choose? Not quite sure of the range of study and work options compatible with your personality, aptitude and interests? Welcome to Career Cafe, where we give you a ringside view of an exciting career each week. Together, we shall explore the pros and cons, the ins and outs, the programs and prospects, all the stuff you need to make an informed and successful career choice. Hi, I'm your host and career guide Pervin Malhotra, and on the menu today we have an interesting field, pharmaceutical sciences. Given India's huge and continuing to grow population and our generally unhealthy lifestyles, it's little surprise that our pharmaceutical sector is the third largest in the world after the US and Japan, and also one of the most advanced amongst the developing countries. What's more, it's growing at a healthy double-digit growth rate every year, estimated at roughly $30 billion. India has the highest number of US FDA approved drugs outside the US. Our expertise in the field of high quality and cheap generic drugs gives us a tremendous edge in pharma exports. And to tell us all about the careers in this field, we have with us a veteran in the pharma sector, Sunil Chaturvedi. Sunil has over 4 decades of experience in marketing and sales in the pharma sector, having worked with several prominent organizations. He is currently the Director of Pharma Network, SPP School of Pharmacy and Technology Management, NMIMS, that's the Narsee Institute of Management, Mumbai, and serves as a subject matter expert and business advisor to Ernst & Young. Welcome to Career Cafe, Sunil. What a pleasure having you with us.
Thank you. Thank you.
So tell me, Sunil, what is it that gives the Indian pharma sector its competitive edge?
Basically because pharma industry is a knowledge intensive industry, and it is quickly becoming the preferred hub destination for manufacturing and for clinical studies. And the large population,
yes,
which is qualified population. So because of that, it is gaining tremendous respect in the pharmaceutical world across.
And our research, is that considered amongst the top? Yes?
I'll give you a brief some macro trends.
Sure.
Basically, see, in India being it's among the BRIC countries and
right.
Turkey, and India is gaining double digit. The GDP growth is more than 7%. Poverty levels are going down. The purchasing levels are going up.
Right.
Now, because of all that, the access to the medicine, for example, Western medicine, which was now just 50%, slowly opening up, and more people are now afford the medicines and for the treatment which is possible, and because of that the sector is opening up.
So the domestic consumption itself is huge.
Is huge. Second reason is that because of the cost of putting up a plant and the pressure which is coming on the abroad, on the price pressure. So India is becoming a favored destination for contract research and manufacturing, and as well as for the increasing the formulation development. I'll give you some data. The $30 billion was the industry about a year back. Now it is slated that it will become $50 billion by 2015.
Does this also include non-allopathic medicine?
No, only allopathic medicines.
Okay.
And the increase which is happening is in 4 areas. The contract research, it is happening in bulk drug exports, it is becoming in formulation exports, and also in domestic formulations. Domestic formulation is just 60,000 crores at this moment, is likely to become 1 lakh crore within 2-3 years.
Oh wow. So if you have any queries related to this absolutely catapulting field, call us quickly on these numbers 1800 11 5314 or 011-230-35420. So Sunil, continue.
Yeah.
This is music
area.
to most job
Yes,
seekers' ears, isn't it?
And another area which is favorable, particularly for India, is the demographic profile. See, we have got now more than 10% people who are 60 plus.
True.
For the first time, 60 plus population is more than under 5 population, and which entails means what? That majority of them would suffer for some time or the other for some chronic illnesses.
True.
Then we have got a large majority of 30 to 50% population in the age of 30 to 60.
So all those
Now,
lifestyle
related disorders,
Right.
and those kind of diseases would increase. Plus we have got a very varied gene population. Now companies which are discovering newer drugs, they don't find such kind of patients
Yes.
abroad.
Right.
Now they find here the timelines which is required for producing a new drug, and
is
the
usually
cost
what, 10-12 years?
is
More?
much more.
Much more.
But in India, because of the gene population and varied population which we have, demographic profile which we have, because of that the timeline is cut short by virtually 50%, and the cost also goes down by 25%. So that is why it is becoming a favored destination for clinical trials. Also, because of this market and abroad also, what is happening is that the generic drugs are becoming popular. There is a health cost pressure abroad also as well as in India. If you see the Indian pharmaceutical industry, how it is divided, the patent gets only 10% of market share, 80% is branded generics, and 10% is generic.
So paracetamol is a
it's a generic name,
Okay,
but crocin is
is
a
a
branded generic.
Right, right.
So, and it's not non-patented. Now what does it entail? It means that there would be a pressure on the companies to produce in India at cheaper rates. It will also be a pressure to make a generic a brand, so there would be more sales and marketing people would be required. There is another interesting data that close to $105 billion worth US dollar worth of patented medicines are going to be non-patented in the next 10 years. It means it opens up a huge capacities for Indian pharmaceutical manufacturers and businesses.
So how does this happen over a period of years?
Over a period of time, because of the patent expiry,
Right.
period expiry, then more companies can make it, and India is expert in process. They can really, with a new process, can extend the life of a molecule, and because of that a business opportunity falls. And because of this reason, not only the sales and marketing people would be required in larger numbers. In fact, there is a data that any given time in India, there are 5,000 sales people vacancies in any month.
Really?
Yes, it's so much in demand.
So is there a high attrition rate as well?
No, there is a, because the generics have to be, there is a pressure on making a generic a brand. So more sales people are required. So
Okay.
more new divisions gets created
That way.
to sell a product, to make it a brand and make big business. So because of that, there are more people required in sales and marketing, plus there are more people required in process and in chemistry. And because of this, the hub it is becoming for manufacture for the multinationals, and that is why most companies, like for example Daiichi bought Ranbaxy or Abbott bought Piramal, because they can't survive without a generic portfolio. So that is why larger companies which are otherwise exclusively in the patent area are also, you know, having a basket of generic products to survive and grow in the world as well as in India.
Oh, wonderful. So the bulk of people
Yes.
employed in the sector, any numbers? How?
I'll tell you, it is also increasing by leaps and bounds. About 8 or 10 years back, there were about 30 lakh odd people employed, direct and indirect. In the direct, for example, in organized sector, there were say about 20,000 odd companies making medicines. Now there are 50,000. There were 2 lakhs people employed in the organized sector. Now there are close to 5 lakh people employed. Similarly, in SMEs, there were about 3 lakh people employed. Now there are close to 5 lakh people employed. Then there is the indirect, where dealers, networks, retailers come. They were 17 lakhs earlier, about 8-10 years back. Now they are close to 25 lakhs. So like that, and similarly in ancillary industries, they are also picking up people. So 30 lakhs jobs were there earlier. Now they are close to 50 lakh people getting employed in the pharmaceutical industry, and that is why it is called a sunrise industry. Apart from auto, the telecom, IT, the media, and entertainment industry, pharmaceutical is a typically high growth knowledge industry.
So the bulk of people working in this sector are in the largest quantum are working in marketing and sales, or is it equally sort of distributed?
Yes. There are more openings in marketing and sales, but still there is a healthy growth in all around. For example, there's some data was there that about 2 crore odd people, 2.3 crore people graduate, and 2,50,000 professionals come out and new jobs gets created. In pharma industry, we have observed that conservative estimate that close to 50,000 jobs get created every year, 10,000 new vacancies, and mostly in sales and marketing, but also areas which are recruiting people in large numbers are in the areas of biotechnology, in chemistry, in analysis,
clinical research,
clinical trials, in hospitals, in the diagnostics, in diagnostics areas. I mean, you think of it.
And pharmacists.
And pharmacists.
Yes, absolutely. The guys who man the shops.
Yeah. That of course, private areas that say for entrepreneur activities, lot of people.
So are there a lot of women in this field as well?
In fact, there are more women now. Even in my college, the ratio is 70-30. There are more women in students, and they are also employed because the areas are such that whether it is sales and marketing or in the laboratories, they excel. So women are in large numbers.
For detail, communication skills and stuff.
They are coming in large numbers.
Oh, wonderful, wonderful. So now tell us, I mean, let's take, since this is a career related program, let's discuss the entry points for some of these key areas. For instance, now you said sales and marketing. All right. Now that's a medical rep. Is that what the person is called? It's called a medical rep. All right. Now, do you need to necessarily have a pharma background to be able to qualify for a job as a medical rep, or a broad life sciences background would also do?
The broad life sciences background will also do, but the progress would be limited. See, when you are talking about product, you have to talk about the benefit of the products. More so when you are making generic a brand, then differentiation has to be created. Now, who can create the differentiation better than the person who has seen how it is made? So if he has noted or she has noted that how the products get made, how the quality get imparted, what are the bioequivalences, how does it perform in the body, that person is able to talk to a doctor, is able to convince to a doctor better as compared to a arts or simple science graduate.
That's true.
So that is one thing. And second thing is that apart from this B Pharma, M Pharmacies, and then the management courses which have now
MBA
come.
In pharmaceutical management.
So that has added great value, and certainly that kind of people who have graduating from B Pharma MBA or M Pharma MBA with specializations are in great demand.
But tell me something. I mean, I come across a lot of young people who sometimes opt for pharma, B Pharma as a default option. You know, they couldn't get into hardcore medicine. So ye kar lo. Is that something you observe too, or do you find quite a few young people specifically looking at pharma?
See, if I look back, say 20-25 years back, there were only 3 sort of jobs in pharma industry. Either you could become an analyst, you could become a chemist, or become a medical representative. And invariably what you are saying is correct. They wanted to become doctor or engineer, and if they don't become a doctor, then they get into pharmacy. Pharmacy also has undergone change. Now that apothecary is not there.
Right.
Now these are all formulations which is there. So, and the choices which has come on the way, apart from becoming an analyst in the clinical trials, in the productions areas, in the manufacturing areas, in the biotechnology areas, it has opened up a great opportunity for people to derive satisfaction. So that is why many people after class 12, they come as a choice in pharmacy. They are no longer trying for any other thing. As a choice they are coming in B pharmacy, and as a choice they graduate into then M Pharma degree. As a choice they do PhD, because now universities are also picking up PhDs, their R&D laboratories are picking up PhDs. So it's in great demand.
So if you want to go into hardcore research and development,
Yeah.
then PhD is
Yes,
mandatory,
yes,
isn't it?
Yes, particularly in R&D areas or in the areas of teaching, PhD is necessary.
Yes, of course,
Yeah.
of course, of course. So now tell me, what should propel a young person to pursue B Pharma, because he's just completed class 12.
Yes.
All right, it's too young to be able to decide
Yeah.
his direction,
Yes.
etc. in terms of career. So what is the aptitude that's best suited for a B Pharma? Of course, marketing and sales could be a little wider, but
Yeah.
just a B Pharm.
See, for a B Pharma, the choices are many. Of course, sales and marketing is one. The another area which is medical writing. There are many IT companies like Cognizant, TCS, they are picking up people in large numbers for medical writing. India is also becoming a great base for medical writing.
Just hold the thought here. We'll take a short break, but when we return, we'll look at the professional outlook and prospects and continue taking all your queries, so stay right there. Welcome back to Career Cafe. We're looking at careers in the pharmaceutical industry, and with us is Sunil Chaturvedi, Director of the NMIMS-SPP School of Pharmacy and Technology, Mumbai. So Sunil, you were telling us just before the break about medical writing.
Yeah.
What exactly is that?
See, basically what I wanted to communicate was that India is favored over China and other countries because India has respected patents, and India has also respected the quality. So because of that, what is happening is that lot of work is coming by the multinationals to create dossiers, to regulatory data, the patents data. For that, lot of data has to be created, the lot of literature has to be created, the continuing medical education programs, which is the focus for the development of the knowledge and communication of knowledge from the industry to the doctors.
Right.
For all that, large number of qualified people are required in medical writing as well as in pharmacovigilance studies.
We have our first call-in, Tripat Saxena. Yes, Tripat ji.
Hello.
Yes.
Good evening, ma'am. I'm a nutritionist
Yes.
from Delhi.
Yes.
And I have a query. I just wanted to know that if I want to develop nutraceuticals in India to face the to solve the problems faced by public health sector, especially related to nutrition, then what is the scope of carrying out clinical trials with these nutraceuticals?
It's a very huge sector now, no? Wellness sector.
Yeah. See, there are many companies, professional companies like Abbott, like Nestle's, which invite people to join them to gain experience in nutraceuticals. Company like Wockhardt, they've got whole divisions. There are many companies have whole divisions, and so there are small companies are also developing SMEs, which are in nutraceuticals, and on a small scale they start their operations. They've got research labs where they can be tested and they can be tried there are laboratories where they can be checked for their efficacy, and then marketing can happen.
So that's where she should target one of these leading companies.
There are many companies, leading as well as SMEs, where they can be targeted.
We have yet another caller.
Yeah.
But before that, I just wanted to ask you, there is this great interest in doing an MBA Pharma.
Yes.
Okay.
Yes.
Now, who should be doing an MBA Pharma?
Ideally, anyone who has done B Pharmacy or M Pharmacy should be doing a MBA Pharma.
So you decide if you don't want to go into the research side and do an M Pharm, then or you do an MBA Pharm?
No, both should, because see, even in the research areas, what the industry is saying now, there's a new requirement which has come up, that even when we take technical people and they are working on research projects, they must know the business connect of what they are doing. And unless they have the management qualification, they are not able to see very clearly the business connect of everyday R&D work which is happening in the labs. So even whether it is B Pharma or whether it is M Pharma, a management degree adds lot of value and to the income and the CTCs which I have seen in the placement area.
We have yet another call. Colin Sudesh from Orissa. Yes.
हेलो मैडम, नमस्ते।
नमस्ते
मैडम, ये जो मैं एक फार्मेसी साइंस में कोर्स करना चाहता हूँ, मैं 12वीं क्लास में साइंस पढ़ाई कर रही हूँ, उसमें क्या करना पड़ेगा, डिटेल से बता सकते हैं?
12वीं का स्टूडेंट है और कह रहा है कि मुझे क्या करना पड़ेगा इस सेक्टर में जाने के लिए। आई थिंक अ बी फार्म वुड बी द फर्स्ट।
See, you have a choice. You can do either a 4-year B Pharma or you can do a 5-year integrated courses of B Pharma with MBA. There are such courses run in our own institute. It is run, and which saves your 1 year, and then you are better qualified for various jobs in 5 years time. So after class 12, if you want to come into B Pharma, I would suggest to do a B Pharma MBA course.
Okay, an integrated course. Because you also save time.
Yeah, you save a full 1 year.
Absolutely. Absolutely, you don't have to come out and take the CAT and then
another.
Apply.
So that's the major.
Right. It's a more fast track route to go in.
Absolutely.
So what are the new developments that you foresee? I mean, from the time you joined and now in the years to come.
One is the problem of plenty. So like we see cars on the roads, there's so many. Similarly, we find that the clinical services, the hospitals, the medical devices, the impact of this all in our lives is going to be huge. Second thing would be that we would be, as we have seen, the average age of Indians at the time of partition, we used to be hardly 50-55 years. Now it is closing to 75 years.
Very
now it's because of the pharmaceutical industry, the people, and all this nutraceuticals also coming in, and the devices also coming in. It's an exciting period to be there in this movement. You can not only see a better future for yourself, but also you can take care of your families better and live a healthy, happy life.
Absolutely, and to that we have another call in, Dushyant. Yes, Dushyant.
Madam, my question is,
hello. Yes.
My question is like Indian engineering services.
Yes.
If there is any service like Indian pharmaceutical services? If there is any post like Indian pharmaceutical services?
No, there is no Indian pharmaceutical service, but there are lots of government departments who are taking pharmacists, B Pharmacy and M Pharmacy, particularly in the various laboratories, in the pharmacovigilance areas, which is developing very fast, as drug inspectors, to take care of the quality and quantities of drugs in the marketplace, in part of FDA, Food and Drug Administration. So there is a lot of opportunities in the government areas. But there is no, a civil services type of,
there is no cadre in that sense. Yes, but you can apply to all the government hospitals. There's a pharmacist required, etc.
Absolutely. They all need a clinical pharmacist.
So what is your parting shot to all the young viewers who are watching this program?
I would suggest that people who are, students, young crowds who is passing out class 12, they must seriously look into coming into this area of pharmaceuticals and in healthcare, and they will find a lot of job opportunities, good paying job opportunities, less competition, and the world opening for them. Because Indian people are required abroad as well as in India. All the companies are coming, and or the Indian companies are becoming large multinationals, which opens up great frontier for educated young people.
Wonderful, wonderful. And with that, we wrap up today's show here. Sunil, thank you so much. I mean, I think this is so inspiring for young people today. You know, typically when students pursue science, they look at it as a bit of a default and dead end and that kind of thing. But here's amazing opportunities in the years to come.
So thank you to you also for inviting me, and I feel happy.
Pleasure, absolute
sharing
pleasure.
This information.
Yes.
Thank you.
And do send us your feedback and queries on Career Cafe lstv@gmail.com. Next week on Career Cafe, we'll look at yet another super career. But before that, let me leave you with one more of my favorite quotes. Careers, like rockets, don't always take off on schedule. The key is to keep working on the engines. So bye for now, and be your best and keep working on your engines.